Afternoon, everybody. I'm going to kick us off. I hope you are all safe and well today. My name is Katie Jacobs from CIPD, and I'm the host for our latest coronavirus webinar. Over the next 45 minutes to an hour, we are going to attempt to shed some clarity and offer advice to employers on where your responsibility lies now that the English government has removed all COVID restrictions as part of its recently announced Living with COVID strategy. Joining me to discuss this topic and to offer thoughts and advice, I'm joined by David D'Souza, Membership Director of the CIPD, Andrew Willis, who's Head of Legal and Advisory at HR Inform, which is the CIPD's employment law resource, and Harvey Francis, Chief People Officer at Skanska UK. Thanks everybody for joining. Before we dive into the topic, I just have to go through a few housekeeping notes. To let you know, the session is being recorded. It will be available on demand. It should be available from this afternoon or so, and you'll also be able to download the slides. You'll be able to find it on the webinar section of the CIPD website. You'll also be able to access all of our previous webinars there, as well as find out about any ones that are coming up. If you want to submit questions to the panel, and I'm sure that you do have a lot of questions, can I ask you to use the Q&A box? Please type any questions into the Q&A box. Do not use the chat box for questions because we won't be monitoring the chat box very closely. We've also muted all of you because we've got a lot of people on the call today. So any questions need to be asked via typing into the Q&A box. However, if you want to share anything or chat to any fellow attendees, then feel free to use the chat box for that. Just remember to set it to everybody, so you can share with everyone rather than just me or the hosts of the session. Do remember that we are updating our FAQs and resources all the time, and that you can find them on the CIPD Coronavirus Hub. CIPD members can also get individual legal advice via our HR Inform helpline, which is available to you 24/7. We won't be able to get into any highly specific situations here, so do remember that you can use that helpline if you need any additional advice. I also want to flag our Wellbeing Hub and Helpline, which is available to CIPD members in the UK and Ireland. You can use this to access free help and support via telephone or online consultations with qualified therapists, and that's provided via Health Assured. I also really just wanted to quickly give some space to the situation in Ukraine. Wanted to say that our thoughts are with the people of the Ukraine at this time. We know the news can be overwhelming and that many of you will be concerned about family and friends and colleagues affected by the crisis. The helpline that I mentioned is available should you need somebody to talk to. And we will continue to monitor the situation and seek ways to support and unite people professionals around the world, not just in this current crisis, but whenever there's violence or heightened tensions globally. Thank you. So moving on to today's session. In England, the government has lifted all COVID-19 restrictions, including testing and self-isolation requirements, as part of its Living with COVID-19 strategy. In Scotland, Wales and Northern Ireland, varying restrictions remain in place for now, but there are plans to ease them in the near future. This means that businesses face a new set of challenges, with responsibility and decision-making ability shifted fully onto employers. How should you be reacting to the current changes? Are you asking people to continue to self-isolate? Are you providing testing or keeping social distancing measures in place? How can you protect employees, especially more vulnerable ones, and avoid presenteeism? What are the legal implications for employers, whatever you decide to do? Those are some really big questions. We might not be able to answer them all in a lot of depth, but our panel are going to offer advice, opinion, and hopefully reassurance as well. We're going to hear from David first with the CIPD view, and then Andrew is going to offer some legal advice. Then we'll get a case study about what Skanska's up to. Please do get your questions in throughout, and we'll take as many as we can. I also received some in advance, so we will take those once we've gone through hearing from each of our panelists. So that's it from me to now. I'm going to hand over to David. Thanks, David.
Thank you, Katie. Hello, everyone, and welcome. And it's been a very tricky last few years, and before we start, it's probably worth acknowledging that. I would describe them as roller coaster, except roller coasters you tend to want to go on again, and it's definitely not an experience that I imagine most people want to repeat. So we've seen work impacted, we've seen society impacted, we've seen people and loved ones impacted, and as Katie referred to just then, we obviously have some very worrying and immediately sad scenes happening around the world at the moment. It has been a very difficult time to support people, to lead people, to make decisions. The level of uncertainty has probably never been higher for most of you in your careers. And we're now facing a period where actually we have to have some more agency over a situation that is still difficult and requires a series, if not an infinity, of judgment calls to be made. And some things we can probably set rules for, and some things will be absolutely contextual and situational, and that will be some of the tension I think that probably comes up in the conversation today. But the good thing is, out of all of these bad things, is that everything's been thrown up in the air, and we have some agency over how it comes down. So we have the possibility and potentially the hope to work out a better way of working, a better way of being together, and a better way of supporting people than may have been possible prior without some of these external triggers. So out of what has been a very turbulent period, what comes is the potential to start thinking about how we might want organisations to be. What I reconcile that with, and what I wouldn't want to fail to acknowledge, is the increased demands on the profession at that same time. So it has been a journey of discovery and challenge from, if you cast your minds back, the initial challenge of actually this seems like it might be a proper pandemic, and are we prepared for that? Do we understand how that might work? Through to, for many organisations, fundamentally different ways of working or challenges to their business model, right the way through a period, and it will have varied across England, Scotland, Wales, Northern Ireland in particular, of very changeable rules, where actually it's unclear at any one period what people should or shouldn't be doing, simply because of the amount of times those expectations have been reset. And we now reach a period where the onus is more on organisations to interpret the situations around them and set out how they want to work with COVID going forward, but more importantly, actually, the expectations of the workplace more broadly. So it's not easy, but there is opportunity within that discomfort and that challenge. So whether it is a series of dilemmas that you are facing in the workplace as to how do we deal with the one person actually who doesn't feel comfortable coming back into the workplace, how do we manage people that are coming back in and have different expectations of how that experience may be, or how you're managing workplaces where actually some people have kept going in a physical location and they're now meeting up with people that maybe aren't, and all of the different expectations that come with and go alongside it from people's reconsideration of their relationship with work and their employer. It's a hugely challenging time. What do you do in terms of support and payment for people if they need to isolate? Or are you still encouraging people to test when they might be coming into the workplace or coming into contact with colleagues? Is that all colleagues, or is that just vulnerable colleagues? These are all questions that organisations are wrestling with. And as Katie said, we won't be able to answer them all today, probably by a long chalk, but actually we can talk about some of them. The other challenge that we have, and it's been quite interesting to hear some of the conversations around it, is rethinking some of the things that were the norms before. So when organisations are saying, well, actually from this point onwards, we wouldn't like people to attend work if they have a contagious disease, you sort of wonder how we ever lived in a period where actually that was expected of people. If you have a cold, if you're potentially infectious, you still come into the workplace, when there was an option for people to do otherwise. So we have a really interesting tension between what we may have always habitually expected from people, and actually, if you go back to basics, what might be reasonable expectations of people in the workplace. And then the final challenge that I would touch upon, so we can go over to Harvey and Andrew and some expertise, would be around how do we ensure that we have sufficient dialogue, involvement from people, and engagement of people to understand their different perspectives around what is fair and reasonable, as we know that people have gone through a far from homogenous experience over the last few years. It has been different and unique for almost every person, based on their characteristics, based on their situation, based on how well they were equipped to deal with it, and based on the support around them. And that means that people will have had a unique experience that will lead to very different expectations and very different beliefs around what might be fair, right, what might be an acceptable level of risk and what might not. And that's very much what organisations are facing into. And I know there's a question in the chat already about CIPD's level of engagement with government around what happens next. We're in active conversations with the relevant departments in Scotland, Wales, and England and Northern Ireland about what might happen next, about the support for business, but also you'll have seen possibly recently our call around improvements in statutory sick pay to take some of the challenge around people's need to attend work when it might otherwise be sensible for them not to be in that environment. So there are a host of challenges, a host of questions. The good thing, if you are a CIPD member and you're on this, is that they're probably things that are best solved for as a community. We don't have a rule book for how we deal with this. We will have some legal guidance, some things we definitely should and shouldn't do, but there will also be contextual pieces that we need to play with. Stay involved, keep asking the questions, and possibly critical to this is everyone understanding and taking some pressure off themselves that we are all having to find a way through it. Organisations are all attempting to work out the best and worst things that they might do, and all discovering as they implement those changes what does work in the way they anticipated and what doesn't. And that's the power of community and communication. It speeds up that learning process, helps us have a better chance of getting to where we want to be, and helps us explore and experiment with some of the things that might drive a better way of working, better standard of work for people. But actually, that is in the interest of organisations and businesses as well. The tension that's historically been painted between do we treat people well or do we run a successful business, we've seen over the last few years that that is a very false positioning, and that those two things go hand in hand. So I'll wrap up there for the moment. But I think as a framing, we have a number of dilemmas that you will be facing that you will probably come across. The best way of solving them is as a community, but pulling on the expertise and content that I know we'll make available to you as you go. Thank you.
Thanks very much, David. And I see we've got some questions coming in. I'm sure that Andrew will address some of these in his presentation on some of the legal things that we need to consider. Thanks, Andrew.
Thanks, Katie. Thanks, David. So yeah, let's look at some of the legal issues around what's happening right now. And the first slide I'm looking at sets out some of the changes that have already been introduced a week ago now. And then there's others that will be due from the 24th of March. And as Kate has already said, this is all really being driven by changes in England. But I have got a slide in a moment that explains where we are in the other nations of the UK. And really all four nations are on a similar journey, albeit they're at different stages of that journey. So what we'll say in a few moments about the challenges facing employers and how they might meet those challenges really applies to you wherever you are in the UK. But just looking at England for a moment, a week ago now, the requirement to self-isolate following a positive COVID test, that's the legal requirement in England to self-isolate following a positive COVID test, was removed, as was the requirement to self-isolate for those close contacts of people with COVID who were not fully vaccinated. Isolation support payments also ended, and that includes the £500 payment for those on low incomes. And there was also the end of the legal obligation on individuals to tell their employers when they are required to self-isolate. Now, you may have something in your contracts of employment that require individuals to keep doing that, but certainly their obligation under the law to do it has now gone. So how you manage that going forward will be something you want to think about, whether it's through a contractual term or whether it's through a reasonable instruction to employees to let you know when they find themselves in that position, so you can plan the best way forward for that individual and for the organisation as well. But they're all of the changes that came in England on the 24th of February. And then coming up on the 24th of March, which was the original intended end date for our COVID restrictions, we've got the removal of an entitlement to SSP from day one for COVID-related absences. And we've also got the removal of the entitlement to be paid SSP for periods of self-isolation where the employee is not tested positive. In other words, they're isolating as a close contact, or where the employee is not unwell. So they may well have tested positive, but they don't have symptoms. SSP is no longer payable on the 24th of March in either of those scenarios. In other words, we will be back to the old, in inverted commas, SSP arrangements, whereby if somebody is ill and too ill to work, they'll receive SSP after 3 waiting days. But if they're well enough to work, they won't be entitled to SSP. And you would envisage in most cases that any contractual sick pay arrangements running alongside SSP won't envisage people having to isolate unless they've been amended over the course of the pandemic. And so the same result will essentially apply. Sick pay for sickness, query what we do about those people who have to isolate for other reasons, and we'll look at that in a couple of slides' time. The other thing to note is that from the 24th of March, you can no longer make claims under the coronavirus SSP rebate scheme. So that scheme allows employers with less than 250 employees to recoup up to 2 weeks SSP for any employee who's off sick with a COVID-related absence. That applies to absences between 21st December 21 and the 17th of March 22. So the claim period, the last claim period you can claim for, ends on the 17th of March. The deadline for making a claim is a week later, the 24th of March. And if we move on to the next slide, please, we'll look then at the changes that are due to come in from the 1st of April. And firstly, on that date or around that date, you'll have the removal of free testing, whether that be PCR testing for people with symptoms or LFT testing for those who are asymptomatic. However, there'll still be a continuing need to follow government guidance where you can, and that is that COVID positive individuals shouldn't attend work and should stay at home and avoid other people for at least 5 full days, and close contact cases should work from home if possible. And I think I've jumped on a couple of slides, so apologies. I think I've mixed my notes up. So let me jump back to this slide. We've talked about the removal of testing, and we've talked about the removal of guidance on voluntary COVID status certification and at-large venues. And that applies to me. As a football fan, I was required to get a test before attending a game until very recently. It was always something I ended up doing at the last minute for some reason, but that's gone now, no need for that. Removal of a health and safety requirement for employers to explicitly consider COVID in their risk assessments, but of course there'll be a continuing obligation to observe general health and safety law to maintain a safe workplace. Finally, from the 1st of April 22, the working safely guidance will either be updated or replaced with new public health guidance, so watch out for that as well. On the next slide, please. Thank you. And this is the slide I talked about earlier, which just touches on the situations in the other nations of the UK. So in Scotland, they're taking quite a cautious approach. There's no plan in Scotland to scrap the requirement to self-isolate for people who test positive, although interestingly, that's never been a legal requirement in Scotland as it was in England until a week ago. But there's still very strong guidance for people to self-isolate who test positive, and that will stay in place. Scotland will keep the length of the quarantine period under review. At the moment, I believe it's still 10 days, but they're keeping that under review. They have had in place throughout the pandemic a recommendation that people work at home where that's possible. They're now recommending that employers consider hybrid working arrangements, but obviously still a very cautious approach in Scotland. In Wales, the requirement to self-isolate is a legal requirement for those who test positive. That remains in place for now, although it can be brought to an end after 6 days, subject to 2 consecutive negative LFTs. That will be reviewed probably around the end of March. And then the situation in Northern Ireland is pretty much as it is in Scotland, in the sense that, again, it's never been a legal requirement for individuals to self-isolate after a positive test, but that has and remains the subject of very strong guidance to do so. Again, the need to self-isolate can be brought to a premature end after 6 days following 2 consecutive negative LFTs. Okay, next slide, please. So this is where I catch up with myself and start talking through those issues I started to touch on before. Why would you want employees to continue to self-isolate as an employer if they either test positive or have close contact with an individual who's positive? Well, firstly, to follow continuing government guidance, which states that COVID positive individuals shouldn't attend work and should stay at home and avoid other people for at least 5 full days, subject to negative LFTs on days 5 and 6, and also that close contact cases should work from home as well and avoid contact with anyone at high risk. Obviously, you may have such people in your workplace. So that guidance is in place and will remain in place, notwithstanding the changed legal status of the requirement to self-isolate. Why else would you want people to self-isolate? Well, of course, as we've already mentioned, there's a duty of care towards employees generally, certainly in terms of health and safety law, and there is a particular duty of care towards those at highest risk of serious illness if they catch COVID. And that will tend to be people with other conditions, or perhaps people who are older, because as we know, older people as a group have been impacted more by COVID in a serious way than other groups, generally speaking. So you've got potential there for direct discrimination claims, but particularly indirect discrimination claims based on age and disability if you get this wrong. So obviously important to have regard to those employees and those groups of employees within your workplace. Why else would you want to ask people to self-isolate? To try and reduce levels of transmission in the workplace, as well as protecting your employees from serious impacts. You also want as many people at work as possible. You don't want them off work with even mild cases of COVID if you can help it. So they're all good reasons to continue asking your employees to self-isolate where they can, where you can accommodate that. Disincentives to doing that? Well, firstly, of course, there's no longer a legal requirement to do it, no possibility of a fine for letting someone with COVID come into the workplace. And you might fear impacts on productivity if too many people self-isolate at once. For employees, of course, there might be particular concerns for them around levels of sick pay they might receive while self-isolating. And as we'll see, that might not be any sick pay at all. So they may well feel pressured to come into work, even though positive. So there are disincentives as well, but I think our advice would be, where possible, try and keep positive people out of the workplace if you can. And how you might do that, we'll look at on the next and final slide. So risks, first of all, we've mentioned the breach of potential health and safety duties to begin with. You've got the risk of fellow employees downing tools if they know that somebody who's positive is in the workplace, especially those who are vulnerable for whatever reason. And don't forget that employers or workers who feel that their health and safety is threatened, imminently threatened, have the right to remove themselves from the workplace, and they're protected when they do that from being dismissed or being subjected to a detriment. And as we've already touched on as well, you've got the risk of claims by fellow employees, be they direct or indirect discrimination claims. Query, would insisting on people attending the workplace, if symptomless, would that be a proportionate means of achieving a legitimate aim? Well, only if you absolutely need people in the workplace and you need them in the workplace there and then. I think otherwise tribunals would look pretty carefully at any claim that you had to have people in the workplace who were positive and potentially presenting a risk to other employees. So, most importantly, what are the solutions? Where people are positive, have conversations with them first and foremost, encourage them to take annual leave if they have any annual leave due. If they have toil, encourage them to use that where possible. And as always throughout this pandemic, encourage flexible working and particularly working from home when that's possible. Consider pay arrangements for periods of self-isolation. As we've already seen, from the 24th of March, those who need to self-isolate who are symptomless or are self-isolating because of contact with others will not be entitled to SSP. And almost certainly, depending on what your contracts say, almost certainly they won't be entitled to contractual sick pay either. So think about how you manage that. Do you pay them in full? If you want to insist on people being away from work and there's no option of them working from home, then really the correct position, unless there's anything to the contrary in the contract, will be to pay them in full, which is obviously a financial burden for employers. But failing to pay them in full, unless you're authorised by the contract to withhold pay, would certainly give rise to a claim in contract or for unlawful deductions, and might also give rise to a claim for constructive dismissal in extreme cases. So do think about how you manage absences for that reason. Encourage people to work from home if they can or take annual leave. But if the last option is to ask them to stay away anyway, think about paying them, because without doing so, you're exposing yourself to potential claims. And I think that covers that for now. We'll look at some questions, obviously, at the end of the session. But I'll hand back to you, Katie, in the meantime.
Thanks very much, Andrew. Great overview as always. A few people asking, will you get the slides? Yes, the slides will be available to download from probably this afternoon or tomorrow. We'll come to your questions in a minute. I'm just going to ask Harvey to kind of give a contextualized example of how this is working in practice at his organisation. Thanks, Harvey.
Sure, thanks, Katie. Hi, everyone. So for those who are not familiar with Skanska, we're a global construction company. We're headquartered in Sweden, and we operate around the Nordics, the US, Central Europe, and in the UK. And in the UK, we have about 3,500 workforce across 5 main areas of operation. So large infrastructure, building and real estate, high-speed rail, building services, and piling and ground engineering. So the approach that we've taken right from the start of COVID has been to base our strategy on the government strategy and position. And actually what we found is that served us very well, because it gives us something to tie back to and people can make sense of it. And we've had very good feedback from our people about the clarity of our position, even when the government position and guidance sometimes, as you'll remember, has been less than black and white. And by way of additional context, we actually have 2 distinct types of workers. So those people based on site, because obviously we're a very physical organisation, and then those based in offices. And for those people based on site, in addition to our own employees, the majority of people on site are employed by supply chain partners, because we very much operate on a non-directly employed basis, sort of construction program management. And we continue to operate the site successfully right the way through the pandemic, because we took a risk-based approach to revising working practices. And as a result of that, we've had very low levels of infection across the workforce. And I do put that down very much to the way that we've redesigned the working practices and patterns around the risk assessments that we've carried out. And in the offices and sites, we continue to ask people to maintain distancing, to wear face coverings in the communal areas. But as a result of the change that Andrew outlined, we've obviously taken a step back and reviewed the approach to make sure that it's still valid and fit for purpose. And we know that despite the sense you get from the media and also the government, I think that somehow this is all behind us, which for clarity, I absolutely disagree with. Many of our people are rightly still worried about catching COVID and are nervous about the workplace. And particularly, I think that's true for the offices. So despite the recent change in the government position, we've been very clear that you must not come into work if you have any signs of COVID or you've had a positive lateral flow test. We're also strongly encouraging people to continue to take lateral flow tests twice a week for the period that they're available. And we've positioned this very much as being in line with our culture, and one of our values, which is very important to Skanska, is about care for life. So what we're saying to people is the reason we want you to stay away from work if you have symptoms or test positive is, in addition to looking after yourself, we also want you to help keep your colleagues safe by not risking them by passing on the virus. And as it stands at the moment, that message has landed, I think, pretty well. So in terms of what Andrew was saying about payment, we're obviously continuing to pay people full sick pay under our absence policy, for those people who stay at home because they've got symptoms or have tested positive under a lateral flow test. And this obviously does raise a subject of trust, because we know in any case, there will always be a small number of people that will abuse the situation. But frankly, us and most organisations have policies and processes in place to deal with foul play, and we'll deal with that under the respective policies. The supply chain situation is a bit different in that the sick pay arrangements differ across our suppliers, but the message that we've given to all of our supply chain partners is the same, which is that we don't want people coming onto Skanska sites if they've got symptoms or have tested positive under a lateral flow test. But during the first wave of the pandemic, we introduced an informal flexible program working called Flexit, and it's interesting, Andrew, talking about, almost the call to employers to have these kind of things in place. And what Flexit does, it allows people and teams to determine the amount of flexibility they've got over when and where they work. Now, clearly, this is more difficult for those working on site because it's a very physical and locational requirement. But we do believe that every role has an opportunity for a degree of flexibility. And this is actually being helpful to us in terms of making it easier for people who've got symptoms not to come into this site or the office. And with regards to the offices, we have two main offices, one in Maple Cross in Hertfordshire and one in Moorgate in London. And we are now starting to actively encourage people to come back into the offices to experience the things that everyone's missed. So social interaction, team effectiveness, and sharing learning. And since the restrictions were lifted, the numbers are really starting to increase, and we're now at the region of about 25% of pre-pandemic office levels. And we've been clear with our folks that, in line with our focus on creating an inclusive workplace, that people really should feel free, if they want to continue to wear face coverings, if that makes them feel safer, and actually asking all of our people to respect other people's choices around whether to wear face coverings or not. And the reality that we're seeing is that once people are back in the office, a lot of those initial fears do quickly dissipate and life starts to feel quite normal again quite quickly. So I guess to kind of wrap up, personally speaking, I have to say I'm very concerned about the Living with COVID plan, which to me falls short of what I would have expected in terms of a kind of a mid to long term approach. In particular, the things that I really worry about is that employees no longer have to tell their employers if they are self-isolating or self-isolate, or take daily tests if they've been in close contact with someone who's tested positive, regardless of whether they've been vaccinated or not. And the worries I've got, unfortunately, do get worse when the availability of free lateral flow tests ends, because I worry that it'll be almost impossible to know who has COVID and who hasn't, because given for the majority of people, it just presents as a cold, a heavy cold. And that was certainly my experience. I had the tail end of the Delta variant towards the end of last year. And if I hadn't lost my sense of smell and taste and tested positive under a PCR, not actually sure I'd known I'd have had COVID, and therefore could have gone into the workplace and passed it on to other people. Now, one of the questions that's been asked of us is, will we provide test kits for employees when the government free issue ends? And we're still thinking about what we need to do in regards to this. And I also think that the other reflection I have is that, based on what we know about how viruses mutate, and also the warnings from people like Chris Whitty, I'm quite sure that Omicron is not the end of the road, as I think it's been painted to be, and that the next variant, I'm guessing, could be even more transmissible and possibly more deadly than Omicron. Worries me that we've kind of lulled ourselves into a false sense of security, that somehow the efficacy of the virus has been reduced in some way. So I suppose my closing comment is that what we have in place now, I firmly believe, is only for now, and that employers will need to be ready to act really quickly and be ready to consider putting back in place stricter measures, because I really don't think that we're end of the road. I think we're at a junction now, but I think things could change very, very quickly. And the problem is, I think the testing regime that we had before, particularly with PCR, is it enabled society and government to be very quickly identify these new strains. And of course, that's going to be taken away from us. So we may actually start to see in the workplace things quicker than actually the way that governments pick those things up. So I think there needs to be quite a lot of thought given about how we feed back what we're seeing to government to enable any change of policies to take place. So Katie, back to you. Thanks.
Thanks very much, Harvey. I'm going to go to questions. Got quite a few. First one I'm going to ask, David, I'll put this to you first. Harvey, you kind of covered it a bit, but maybe we'll come back and we'll go to Andrew for a legal viewpoint. Lots of questions about testing. If tests are no longer free, should employers be providing them? Is it fair and reasonable to expect people to pay for them themselves? If, as Harvey intimated, people don't know that they have COVID and are coming in asymptomatic. David, what's your view on kind of how employers deal with this kind of changing testing landscape?
I think it's going back to the overarching duty of care. So if there's less flexibility, you're expecting people to be in close proximity and you think there's high risk, then an organisation needs to think about actually it's long-term versus short-term costs in that scenario. Because as Andrew pointed out rightfully, there's a risk of disruption, there's a risk of severely impacting people's health. One of the things that we haven't really spoken about is actually caring implications as well, that some people will be anxious and nervous not because of the risk to their immediate health, but because if they catch an infectious disease, it will have a consequent risk for people that they care about or are close to. So organisations are under an awful lot of cost pressure at the moment, but depending on the environment, it should certainly be risk assessed, and the organisation should be thinking really seriously about how does it minimise the risk to its people, minimise the risk to its operations, and minimise the risk to the people that might be in contact with them.
Thank you. I mean, Harvey, can you share any more on kind of what you're doing around asymptomatic, or for thinking around how you would approach that?
Yeah, I think, as I said, Katie, we're still considering what the approach should be. We've looked into the cost of providing lateral flow tests, but as David said, it's balancing in the short and long term, because I think there is a very real danger if people don't know they've got it, because I think still a third of people present in asymptomatic or don't present because they're asymptomatic, but also people might be confused whether they have it or not, or just come into work as David was saying, historically people have come into work with a cold and that was kind of socially acceptable. I think it's less so now. So we're trying to weigh up from a productivity perspective whether there's greater risk in terms of not testing and potentially having a kind of, because all of our sites, or majority of our sites, particularly the building ones, they're indoors and you get large numbers of people together. So unfortunately, they would be breeding grounds, I think, for transmission. And I think the risk assessment, the mixture of the vaccinations, the testing and the risk assessments that we've put in place, we've done a good job across those three strategies of kind of keeping the workplaces safe. But if you don't know what you've got coming through the gates, it's much more difficult. So we haven't concluded a position yet. There's much more discussion, I think, still to be had on that.
Thanks. Andrew, can I come to you? Same question, but some people asking kind of what advice can you give businesses to require employees to provide proof of COVID positive symptoms, or I guess also negative symptoms?
I think it's entirely reasonable to ask or seek ways in which you can confirm the COVID status of people coming into your premises and working alongside your other employees. The thorny issue is around cost and what you do about that once free testing ends from April onwards. And really, unless you've got something contractual already in place, which is all unlikely, it's one for negotiation between employer and employee as to who bears the cost of that. I think most employees would see the sense in testing, but they might be more reluctant to get involved with it if it's a cost to them. And one particular issue to be aware of is minimum wage issues, because we've seen cases where employers who employ people right on minimum wage have inadvertently ended up paying less than minimum wage by requiring them to spend money on uniforms or on equipment, and requiring them to spend money on testing does run the risk of ending up getting exactly the same scenario, and then employers inadvertently breaching minimum wage legislation and being named and shamed for that reason. So that's definitely one to be aware of for those on lower incomes. As regards cost more generally, it is one for negotiation, because really it's not something I don't think that most employers will be able to insist on.
Thank you. We've got a couple of questions about how COVID kind of going forward counts towards somebody's sickness absence records. David, any views on as we move into this living with COVID strategy, how employers kind of report and track it? I
think at the moment it would be normal as Harvey says, not I don't consider it done. There's certainly a period of adjustment, and there may be a period, as Harvey rightly outlined, where we may need to go back in terms of different restrictions and considerations. I think treating COVID and long COVID as uniquely different things needs to be done sensibly and on its merit. So there's something about the uniqueness of the infectious profile and the impact it can have. But actually, when it gets to things like long COVID, we need to think about the long-term care of people with long-term sick problems more broadly. And it shouldn't be that organisations are disadvantaging people who are presenting with medical problems that simply have a different name but may have similar manifestations. So I think treating COVID as a unique event absolutely made sense. As organisations come to deal with it longer term, need to think actually around the sickness policy more broadly, the way that's treated and the way people are supported if they have long-term health issues.
Thank you. We've actually got a few questions about long COVID. Asked one of my lovely colleagues, Rachel, could you put a link to the report we've got out on long COVID in the chat? But on the topic of long COVID, Harvey, do you think employers should be doing kind of more around it? Somebody said we're making reasonable adjustments and monitoring, but should we be doing more there? It got employees presenting with a self-obsessed long-term disability. Self-assessed.
Yeah, it's interesting. We've actually not had many cases of long COVID, but I suspect it's probably because we're quite early in the cycle. And I guess we're also fortunate that our absence policy and payment policy is quite generous. So whilst, a bit like Dave was saying, whilst we have the policy in place, and actually we treat COVID now, so it contributes to the normal kind of build up of sickness days that are taken in terms of what people are allowed to have. There's always an element of judgment, and I think you have to have that element of judgment because we're in uncharted waters. We're dealing with something that we don't fully understand, that's still very new, and of course, typically in HR and everywhere else, we always try to kind of button everything down and look for hard and fast solutions. And of course, when you've got something that's new and evolving at such a pace, I kind of think we have to be more flexible and apply more judgment in terms of what's going on, and be prepared to act quickly, but also to change our views and our policies and processes as this thing starts to develop and we know more about it.
Andrew, any kind of legal thoughts on kind of long COVID as it emerges and we get more and more people presenting with it?
Absolutely. I mean, as our attendees will know, disability is very broadly defined in the Equality Act. And so a condition that's likely to last for 6 months or longer almost certainly will be regarded as a disability, and therefore the duty to make reasonable adjustments arises. You mentioned a case where somebody had self-diagnosed as having long COVID. I think you would treat an illness like this in the way you would treat any long-term illness, and you should obtain medical evidence where you can, whether from the employee's GP or consultant or from an occupational health service, and make decisions based on the information that comes back from that expert input. I think the issue with long COVID will be, though, that it's still not clearly defined as a condition. I think we're still learning about what it is, what it entails, and the various symptoms that people might present with. So still treat it with caution, and do listen to your employees when they're telling you of the symptoms they're suffering and how they're personally being affected. And as with any capability or sickness management process, do manage it on an individual basis and take into account individual characteristics, but certainly obtain medical evidence and treat broadly in the same way as you would, but bear in mind it's a new condition, and we're still not yet absolutely clear as to what it might entail. So if there is any doubt as to what the employee is experiencing, exercise discretion in favour of them rather than the employer on this particular one, I think.
Yeah. Andrew, I'm going to stick with you. I've got a few questions on face masks. Where do employers stand on that? Can they require employees to wear them? I mean, somebody said they put a policy in place that if someone wants to come in after testing positive, they have to wear a mask. Other people asking, can they require people to wear masks?
I think that's a reasonable request to make of people. It depends to a degree on the circumstances and the particular environment that people are working in, but I think that is a reasonable request to make of people. People will argue back on the basis that we're no longer required to wear face masks in public places. And also there'll be some individuals who have good reason not to wear a mask. So again, it's about having individual conversations with those people and finding out what those reasons are, because again, if they're disability related, if somebody has asthma and finds wearing a mask intolerable, for example, and insisting on them doing that might well give rise to an issue with them and potentially create a claim that they might pursue. But I think as a general rule, following that policy is a reasonable thing to do.
Yeah. Harvey and David got a few questions about encouraging people back to offices, people struggling to get people back into shared spaces, people who are not clinically vulnerable, refusing to come in, want to carry on working from home. David, come to you first. Kind of what approach do you think employers should be taking around kind of reluctant returners to any space?
So initially empathetic. So the starting point has to be, I can understand how someone could feel like that. So I could understand why someone would be anxious. I can understand why this might be a change. I can understand why it may be difficult actually for me to understand that if I'm in a different situation or circumstance. Then it's about being really clear on the messaging in the organisation and the approach the organisation will take. So it's very clear what is there to make people safe or how people would engage. And then to the point that Andrew's made, and I know Harvey has multiple times, it's about having some flexibility within that. So why do you require people to be back in? Is that a general principle, or is that necessary for their role? Because they're slightly different things. Is it appropriate for that individual if they can work flexibly and if they have a genuine need? So it might be mental health or wellbeing issue, it might be a broader health issue. They all need to be factored in. So I think there are things you can do to encourage people back in. You can lean on the importance of the social connections that people may have. You can lean on actually the fact that, for many people, a change of scenery will be welcome. But what you don't want to do is probably have people in that environment unnecessarily, while there is still an infectious disease in circulation. You probably don't want to force people who could do their job perfectly well from home into a position where they feel fundamentally uncomfortable in the office. That said, there's stuff that you can do and things that you should do to make people feel as comfortable and secure when they do come in as possible.
Thanks. Harvey, can you give some examples of what you're doing in practice?
Yeah, I think I very much agree with David that it's about empathy and it's about discussion, and it has to be about need, and that's why I talked about our Flexit program. First, it's very simple. The first thing is what are the business needs or the customer needs? What is it that the job output needs to deliver, and how can it be done? The second is then what's the needs of the team in terms of connection, learning, sharing, all of those things. And then it's about the preferences for the individual in terms of their working pattern. So we haven't issued a 3-line whip. What we're now starting to do is talk more in our communications, in our CEO briefings, about the benefits of coming back into the office 1 or 2, at least start coming in maybe 1 or 2 days a week. And what we're finding is, for the majority of people, as I said, actually once they're in, they realise that actually the environment is okay, the atmosphere is okay, our COVID levels are very low. We talk quite a lot about what we're doing to keep the offices safe, about the increased ventilation, the fact that trying to give people personal space. And I guess at some point there will be a residual number of people who just won't want to do it, and then I guess there'll be the difficult conversations if we need them to come into the office. I suppose you'll end up in a frustration of contract, and then the inevitable discussions that come on from there. I would hope that would be very, very few and far between, and I would hope again we're quite a long way away from that.
Thank you. Yeah, David.
Yeah, I'd just say as a story on that, I think you will have the vast majority of people will have legitimate reasons for that, and we should be designing organisations around people who are doing the right thing rather than the exceptions to it. That said, I spoke to an HR director recently, and they'd been attempting to encourage someone back into the office, eventually ended up in a position where there was clear conflict between them, and then they noticed on the HR system that they'd moved to the other end of the country during the pandemic and were no longer in any way commutable whatsoever. So I think, but they're the fringe and outlier cases that we shouldn't be designing around. We should be designing around what's right for people who we assume have the right intent.
Thank you. Andrew, somebody's asked about vaccinations. Where do we stand legally now in not allowing those who are unvaccinated to return to work in a workspace or an office?
Well, I think we were never quite sure where we stood legally on that. One or two employers have taken a fairly robust approach to it and said, if you're not vaccinated, you're not coming back to us. But obviously the government's backtracked from implementing that kind of requirement in the care setting. Again, it comes down to individual circumstances, really. I think requiring people to be vaccinated before they come back, it might be arguable in certain settings like care settings or in settings where you might have regular contact with other vulnerable people. But it becomes hard to justify in a more general setting or in a more general workplace, especially when the government's backtracked from making that mandatory in care and health settings, as I've said. So I think you have to tread with care. And again, it's again about talking to individuals, because there'll be some individuals with very good reason not to be vaccinated, and insisting that they are will be discriminatory in some way. But that's the risk you run in imposing that kind of requirement. I think the way a lot of employers have gone about this is actually to send a positive message out. We've had this many people with the first jab, this many people with a second or booster jab. We're now running at 60, 70, 80%, sending out that repeated positive message to try and up vaccination rates in that way, rather than impose something as a requirement.
Yeah. Can we talk a little bit about fairness and people who can work from home versus people who are just unable to work from home? Harvey, how are you dealing with that kind of potential division in a workforce? Some questions about, just some people are unable to work from home.
Yeah, we have had some of that, and it's more prevalent, I'm guessing, on site. So it was much more of an issue during the first phase of the pandemic than it is now. I think a lot of those issues have just fallen away. A lot of the site people were saying, it's okay for them being able to kind of work from home. And actually, when you gave the, well, actually, would you like to do that? And people say, no, I didn't join the industry to work from home. Well, it's like, so there is always sometimes that sense of what somebody else has got. And actually, I think we're over that now, and people understand. I think they're much more informed about why that might be. And as I say, we haven't had really any real issues. We've managed to work through any of those cases where we've had reluctance or issues, but I'm sure they will come. But I think we'll just deal with them in the usual way, through discussion and diplomacy, and try to work out an agreeable solution. But the kind of sense of factions has gone now.
Good to hear. I can see in the chat somebody acting as a dealer for lateral flow tests. A link there, and various pricing options available if anybody's interested in bulk buying. Can we talk a little bit, we're running out of time rapidly, but a bit about presenteeism in general and people coming into the office sick. A few people asking around, can you ask people or should you ask people to test if they're presenting any kind of cold-like symptoms? But I guess the following question on from that would be, should people be coming in at all when presenting with any kind of symptom or feeling under the weather? And David, what's your view on how this is going to change how we think about coming to work sick?
I really hope it fundamentally changes it. It's one of the least useful aspects of our concept of work ethic, that we can really show commitment by putting other people in danger of catching the nasty bug that we've picked up. It doesn't make sense from an organisational point of view. And whether or not people keep coming in, we know that they aren't optimal at their time in terms of that performance. And we know that they're risking other people being less optimal. And we know their recovery time will go up as well. So there is nothing good or laudable about people dragging themselves into work. It's been glorified in a really unhelpful way. I am hoping that this is one of the points where we start thinking about not just COVID, but any kind of infectious disease, and say that if we've got an opportunity for people not to be in a working environment with other people when they might make them sick, we will fundamentally discourage that by the way we think about our policies, procedures, support mechanics.
Thank you. And Harvey, do you agree? Is that something you would like to see?
It's something I would absolutely love to see from a personal perspective as well as a corporate perspective. But I think the reality is, I think it's much harder when, as I said, so I think for the site-based people where the work is less able to be done elsewhere, I think it's more difficult. But there's ways and means around that. You know, if it's usually the most infectious for 1 or 2 days, in the grand scheme of a year, it really shouldn't be a problem. But I am a bit like David. I'm starting to sense there is a sea change happening. And what we've got to do is that, I think from a leadership perspective, this is the key to it. I think leadership and culture is that the leaders need to be seen when they're sick to be holding meetings from home via Teams or Zoom, and actually role modeling the kind of behaviours we want to see. If leaders come in coughing and sniffling and stuff, that just sets the tone that actually that's what's expected. So, you know, encouraging the senior teams, if they're unwell, not to do that.
Yeah, and Andrew, somebody's asked, if somebody is presenting with symptoms, can you insist that they take a lateral flow?
It comes back to that cost issue again, but if you can provide them with a test, I see nothing wrong at all with asking them to take a test. It's entirely consistent with the employer's health and safety obligation to maintain a safe workplace. So that's a perfectly reasonable request to make, and I think asking people to work from home, if they can, is reasonable as well. There's one little issue around pay, of course. If they're well enough to work, but not well enough in your view to be in the workplace, then you should allow them to work at home. If that isn't possible and they're presenting for work, consider paying them in full, as we talked about earlier. Otherwise, there's a potential there for some kind of legal fallout from that. But yeah, I think generally speaking, taking that line is entirely consistent with an employer's obligations as to health and safety.
Yeah, I'm going to bring it to a close. I'm aware that we haven't answered all the questions. Some of them are quite detailed, so apologies I didn't get to those. Andrew's slides will be available to download. You will be able to get those. I think quite a lot of the questions you'll be able to figure out the answers from that. But also like to remind you that if you are a CIPD member, you do have access to the employment law helpline via HR Inform. So that's available for you 24/7, and you can call and go through your issues over the phone with somebody, and you'll get a response there. This session will be available to watch again. Should be available on the CIPD website from this afternoon. I'd like to thank Andrew, David and Harvey. Thanks so much for giving up your time and insight. Thanks everybody for attending. I hope that it's answered at least some of your questions. As Harvey said, use that phrase, we are in uncharted territory. And I think it is up to employers to think about what is reasonable for you and for your workforce, and to come from a place of empathy as well and compassion. But that's it from us for now. Do check on the CIPD website for more information about upcoming webinars, but please have a great afternoon. Thanks very much.